Science,
engineering,
medicine,
chemistry,
physics,
biology, humanities, cardiology,
computer, public health, global
science communication.
Greetings everybody, I hope you're well. I'm Gareth Mitchell. Today, the latest on human challenge trials where people are purposefully infected with the coronavirus. Also in this edition, air quality monitoring goes truly local, quite possibly to your community, especially if you want to get involved.
There's a huge advantage to community monitoring, which is people know their areas. There's grassroots community groups that want to put in a new park or lobby for electric bus routes or try to get a new walking route to school, or maybe even just a PTA raising money to increase the pollution protection around the school. So there's great possibilities for this project and we're really excited by it.
And excitement over plastics too. We're hearing from the startup that's producing cling film and other plastics that take only a year or less to break down.
The Imperial College Podcast.
All right, well, first up, let's jump in with a little bit of news. Hayley Dunning joins us first with particle physics news. Hayley, what's going on here?
Yes, so this is potentially exciting new news from CERN and the Large Hadron Collider of Higgs boson fame in 2012. So physicists are often trying to look for new physics. They're actually often trying to break their own models. So the standard in particle physics is literally called the Standard Model. It's our sort of laws of nature at the moment, how we understand how particles and forces interact. But there are some things in physics that the Standard Model can't explain, like dark matter or why there's more matter in the universe instead of antimatter. So a lot of the experiments at the Large Hadron Collider are trying to find any kind of differences in the way particles behave that can't be explained by the Standard Model, where we might find some of this new physics. And this week they have hints that they may have found one of these differences.
And what are these hints?
So it concerns a couple of types of fundamental particles, so electrons, which you probably know about, and then muons, which are like their cousins and they're a little bit heavier. But normally in physics we treat them kind of the same. We expect them to behave in very similar ways except for the slight difference in their mass. But what they found, so the Large Hadron Collider, it just crashes particles together and sees what comes out of them. And in one particular kind of experiment with these particles called beauty quarks, they found that when they decay, they expected the same amount of decay into muons and electrons, but they've actually found a difference.
Oh, a discrepancy. So what might they think? I know it's really early stages, but what might account for this discrepancy, this difference? Well,
the beautiful thing about that is that they don't know, and they kind of don't. They wanted to find things that they can't explain, so that then if this phenomenon turns out to be real, when they've got a lot more data, then they can start to look into a bit more about why that might happen, whether there are other particles that we don't know about, like the Higgs boson, or whether there are other forces acting that we don't know about before.
And what's the Imperial involvement in all this?
So a team of our researchers have actually led part of the analysis of the results of this. So that's led by Dr. Mitesh Patel in the Department of Physics, and a team that includes, PhD students and everything like that are working out in CERN.
So still presumably quite a lot to investigate. I think it's always lovely when scientists don't fully know. That's often where the excitement is. So where next?
Yeah, definitely. I think researchers at the Large Hadron Collider have always been waiting for something that they don't know to emerge. So at the moment, this result is quite robust. They've got some data, but it's not the kind of gold standard of what they'd want in physics in terms of the statistics of how unlikely it is to just be a fluke in the data. So they're going to collect a lot more data, but they are very cautiously optimistic and very excited.
All right, Hayley, thank you very much indeed for that. Well, now we're delighted to meet for the first time on this podcast Rosa Salazar-Benazar, who's recently joined Imperial. You've been with us since January, haven't you, Rosa?
Yeah, that's correct.
Welcome aboard. And we're going to put you straight into the deep end here by getting you to tell me about this new Centre for Climate Change Innovation. Tell me more about this.
So the Center for Climate Change Innovation is an initiative of the Grantham Institute at the Imperial College and the Royal Institution. And we have 6 founding partners. So Arab, the Mayor of London, HSBC UK, Octopus Center for Net Zero, Pollination, and Slaughter & May. And the main purpose of the center is to radically increase the speed with which practical solutions to tackle the climate crisis are created and implemented. So that's in the UK and internationally. And the center will be a place where innovators can relate with technology businesses, policymakers, and other stakeholders to accelerate the innovation.
And when did the new centre launch and what happened at the launch?
So the new Center for Climate Change Innovation launched on Thursday, 18th of March. And we had a live event and we had a video message recording from His Royal Highness, the Prince of Wales, highlighting the importance of innovation and how it is a matter that is very close to his heart. And we invited the partners, the 6 founding partners, the Royal Institution as well, to discuss how every partner saw the role of innovation within their sector, but also what they will bring to the table and to the center. We also invited innovators, so to hear about the clean tech startup ecosystem and the opportunities that will be made in the center to connect innovators, policymakers, those in the investing community, and all that are interested in the Center for Climate Change Innovation.
So why is it felt that we need this new centre?
So we're at a very important moment where we must decide if economic recovery from COVID-19 pandemic will be green and sustainable, or if it will be business as usual. And in regards to climate change, we know what needs to be done, but nowhere in the world is meeting carbon reduction targets or building mitigation for existing environmental damage quickly enough. So the role of the center will be to accelerate the transition to net zero. And we will do this by having practical innovations that can make a real difference and in a way that they can be scaled like it has never been achieved before.
Now, also, I gather that a big part of the mission, as it were, is the public engagement and outreach. Tell me more about that.
Yes, absolutely. And the center being in a global city like London, that means that there's a lot of responsibility to help shape low carbon and climate resilient future for the world. And that means having climate justice at its heart and connecting and including broad communities in the way that we reshape the transition to net zero. So we expect the center to help us shape the efforts to net zero. We will have a commitment to engagement, education, and support of implementation of innovative ideas in broad communities.
All right. Well, a lot to look forward to there. Thanks so much for that, Rosa Salazar Benazar. It's great to speak to you and welcome to the podcast. Well, now, healthy volunteers are being infected deliberately with SARS-CoV-2, the virus that causes COVID-19. It's in a landmark clinical trial underway in a London hospital, and it should provide crucial insights into COVID-19 and help deliver new vaccines and treatments. Imperial researchers are part of the team leading this, the world's first human challenge study for COVID-19. Ryan O'Hare has been hearing from Dr. Chris Chu of Imperial's Department of Infectious Disease. Chris is the chief investigator on the study. So first, why the need for a clinical trial like this?
There's a limit to what you can understand from investigating patients who get disease, mainly because it's very unpredictable when people develop infections. They get exposed to viruses in all sorts of different environments. They may get a large amount of virus or a small amount of virus over a longer period of time, for example. And it's always difficult to assess exactly what strain of virus they've been exposed to. So all of these things make the actual infection that they develop quite variable. And so to try and understand the factors which are involved in protecting people is really difficult. So the real strength of these types of human infection challenge studies is that you have a lot of control. So we use a well-characterized virus. We take a very small amount of this and put it in people's noses by nasal drops. And the volunteers that we ask for to enter these studies are people that we know are very unlikely to get severe outcomes. And then we have a whole range of safety measures in place to make sure that the whole process is as safe as it can be. So these volunteers, they come to a special unit and they will be quarantined in the Royal Free Hospital for at least 2 weeks. During that time, they'll be monitored all the time by very experienced doctors and nurses. And if anything indicates that they're getting slightly more ill, then they will be assessed and they'll be given any treatment that they need.
We could argue that we already have a pretty good idea of what happens in COVID-19, in the disease. And there's growing naturally acquired immunity in the community, multiple vaccines being rolled out in the UK and other countries. So what more can this type of study tell us that we couldn't get from sort of in the wild?
So virtually everything we know is from patients who have developed symptoms and come to see a doctor or come to the hospital with COVID. So what we know very little about is what happens in people who don't come to the hospital. And that is primarily younger people and people who have mild symptoms. So the first thing that we'll be able to find out is the nature of this type of mild infection, and particularly the incubation period, so the period before people develop symptoms, which really you can't investigate in any other kind of way. And then also to be able to assess whether these younger people getting infected shed a lot of virus and are potentially major causes of onward transmission in the pandemic. But probably more importantly, once the system is set up and once we've shown that this can be done safely and robustly, then we will very quickly be moving on to testing vaccines, antivirals and other treatments. And it's true that there are first generation vaccines which are being rolled out and they're highly effective, but I think there are lots of issues with these vaccines. First of all, there's issues with limited availability. So currently it's estimated that perhaps only 1 in 9 people in the developing world are going to be able to be vaccinated within this year. So we need to have more access to different kinds of vaccines which are more accessible, particularly to low and middle income settings. Perhaps ones which don't need 2 injections, perhaps ones which don't need to be injected at all. So I think there still need to be a lot of new vaccines which need to be developed. And as cases fall in parts of the world where clinical trials can be done due to vaccination and due to social distancing and so on, it's going to be really difficult to test whether those new vaccines work at all. So that would be the main aim of setting up this type of research now.
Now, obviously, there's quite a long history of these type of studies, and your team have carried them out with RSV, with flu. And as I said, you're the first group to carry it out with SARS-CoV-2. What's the sort of finding that you're most excited to get, or the one thing that you really want to get out of this study?
To me, what's most interesting will be getting that full understanding of how the body is responding to this particular infection and being able to pick out exactly what types of immune responses and parts of the immune system that will be responsible for protection, because that will mean that we can design better vaccines to replicate those features and protect more people.
Chris Chew speaking to Ryan O'Hare. Well, now, concerned about the air quality in your area? Well, from this summer, you will really be able to do something about it by participating in a scheme to install measurement nodes in your neighbourhood. The Breathe London Network is an air quality sensing community made by Londoners for Londoners. Andrew Grieve is a senior air quality analyst in the Environmental Research Group at Imperial, and he's been telling Hayley Dunning more about the aims of the project.
The overarching aim is to democratise air quality monitoring. For a long time, the only way you could do it really was with big expensive equipment that needed to be housed in something on the roadside. But what's happened recently is there's been a rise in smaller, cheaper air quality monitors that have made it possible now for people to monitor air quality by themselves. One of the problems though is that anyone can make an air quality monitor and sell it and say it's the best ever, and you as a consumer don't really have any idea whether it is any good or not. So what the Breathe London project aims to do is to bring these smaller, more affordable more easily deployed monitors to community groups, but to also give it the backing of us at Imperial looking at the data, quality assuring it, making sure that it's as good as it possibly can be. So that's sort of the overarching aim. One of the other aims of the project is to make sure that we are monitoring at schools. And there's been an increasing amount of research that shows that the impacts of air pollution are not equal across society, that there are some groups and some demographics that are more affected by air pollution than others. Quite often these are lower income groups that are in areas that are more polluted. So one of the other aims of the project is to try to reach communities that are affected by pollution but have so far maybe not as engaged in it as some other communities are.
As part of this project, to start with, you're hoping to install more than 100 air quality sensors around the city. You've mentioned schools, but where else will they go and why?
The project is in a few phases. So the first phase is installing monitors that are sponsored by the Mayor's Office. They're going into 10 hospitals and around 30 schools. There's also going to be one in every borough. And then there's around 20 that are co-located at reference monitoring station sites. And that's really important because that allows us to keep a constant eye on how the sensors are performing through the year. Once we get to June or July and we've got that initial network set up, then that's when we open it up to community groups and businesses, business improvement districts, estates, individuals. But anyone with a passion to improve air quality in their area is welcome to join at that point.
So how does this buying into the network work when it comes to that stage of opening it up?
Bloomberg Philanthropies are involved in the project as well, and they've made some funding available to sponsor over 50 nodes for community groups to apply for.
What could the data from the network help communities achieve?
There's a huge advantage to community monitoring, which is people know their areas, they know where the problems are, or maybe not, maybe it uncovers something new. But monitoring is one half of the story. The other half of the story is, what do community groups do with this information? How does it galvanise action in local areas? You can start to see some of this happening already. There's grassroots community groups that want to put in a new park or lobby for electric bus routes or try to get a new walking route to school, play streets every Sunday, or maybe even just a PTA raising money to increase the pollution protection around the school. So there's great possibilities for this project and we're really excited by it.
Now, we've talked about how air pollution is obviously a very important topic, but we've all been a little bit distracted recently by the pandemic. But as we start to come out of that and air pollution becomes a hot topic again and we get out more onto the streets, how can this project help London clean up its toxic air?
If you look at sort of what the Mayor's been saying about this network, a lot of the messaging around the network is to help London build back better, and that we don't just want to go back to exactly how the way things were. There's been a huge increase in cycling, which has been great. There's a little bit of a worry that people might still be a bit worried about getting back onto public transport. So I think it's going to be really important to keep an eye on air quality as things start to open up again. I think what we want to get to is to a better place than we started off at. And I think democratising air quality monitoring and helping people understand and improve air quality in their own communities, and it being more of a grassroots movement than a top-down movement. It's very important that we have moves from government and from city mayors as well to improve air quality. But we can have both. If we have groups at the bottom working in their own communities and we also have action from the top, then those two things combined together can hopefully help us to improve air quality over the longer term.
Andrew Grieve speaking to Hayley, and you can find out more at breathelondon.org. That's breathelondon.org. And finally, addressing the plastics problem. And this is the story of the startup producing food packaging plastics that break down within a year and can be recycled into products like flower pots or pallets. They're making various other kinds of plastic materials as well. Polymateria is based at Imperial's White City campus, and the CEO is Neil Dunn. He's been speaking to the Green Minds podcast presented by Lottie Plashkes, and here's an excerpt.
Polymateria's mission is to advance science to help nature deal with plastic pollution. And in order to do that, we've worked very closely with the molecular science division within Imperial college and have combined, polymer science together with biology and chemistry to come up with the unique IP that we call biotransformation.
So digging into the technology a bit, what is biotransformation and how can it be applied?
We've really obsessed about why have previous technologies failed? Why have they claimed biodegradation and been limited by either a propensity to create microplastic or only would biodegrade in certain, niche situations like industrial composting facilities? What we figured out is that in order to avoid microplastic, you need to attack and destroy the hard crystalline region of the polymer structure. If you don't do that, you're creating microplastic. What that feels like to everyday people is quite quickly you have something that's no longer a plastic, no longer a polymer. It's going to act and behave like a grease or a wax-like material. And the second thing you need to figure out is how do you make that grease or wax attractive to nature? So we load it with a prebiotic, which draws in the microbes and the fungi and the bacteria so that they attack and assimilate it, which doesn't happen with a microplastic. It doesn't happen if you're still a plastic. Those two things alone are the reason why we're able to get, for the most highly fugitive, the most highly littered forms of plastic, we can get that fully back to nature. And we're the only company in the world who has done that at ISO accredited labs under real world conditions. So that's the biodegradation piece of biotransformation. The other piece that's really important is being able to time control it, because you don't obviously want this going off in your home or in your supply chain. The wholesaling of the materials, we allow for the in-use phase, and then we add whatever time frame the brands and the converters tell us. We can be really precise and program that to a month, anytime from 6 months to 3 years, which is very, very relevant and useful for food packaging, the type of stuff that's, winding up in the natural environment. And 32% of all plastic winds up in the natural environment. So no creation of microplastic, no harm to the natural environment, acute or chronic effects per Ecotox OECD guidelines. And then at the end of the day, under a reasonable time frame of a year, maximum 2, that all you're left with is carbon dioxide, water, and biomass. Now, all of this sounds simple, but no one had taken the time to create really rigorous pass-fail criteria based on science on each of those things.
And how much does it cost? So let's say I was about to buy a bottle of orange juice and there were 2 identical bottles of orange juice, except one manufacturer had used Polymateria's technology. What's the kind of additional cost to me?
For you wouldn't even notice. So it's a rounding error. So our business model is a licensing model. We license the technology out to what are called master batch companies, but also packaging. The guys who make the packaging, make the film and convert it into the final finished product. It'll be anywhere from 10 to 15% additionality on the finished cost of the packaging. That's what the brand sees. And then in terms of what the consumer sees, your candy wrapper is a penny or less. 10 to 15% of that is, like I said, around here.
Why do you think that biotransformation is going to be a really big part of the solution to the plastics problem as opposed to other technologies? I know a lot of people say we should just try to wean society off single-use plastics entirely, particularly since obviously the manufacture of plastics requires fossil fuels. So I'm kind of curious to know your perspective on that.
Yeah. I mean, to anyone who says that, ultimately you're right. Where this fits in the waste hierarchy is we absolutely need to reduce, the frivolous, needless uses of plastic, the cocktail stirrers, the tinsel, the glitter, the stuff that frankly is just, not providing any utility. We also need to recycle it and we need to reuse it. And the clear area that we see the opportunity is in food service packaging, because there really is no reasonable alternative unless we want to create a mountain of food waste, or unless we want to, use unsafe materials that are, not good for human health. Plastic is a very efficient material. And the opportunity here is really to look at where plastic is really needed and to redesign those materials so that they're pure and they can perform better in recycling and also perform better if they do wind up in the natural environment. Whilst it's going to take close to $1 trillion in decades to kind of deliver the type of circularity on plastic packaging that, frankly, we need. In the meantime, technologies like this can kind of help us get there and be much more efficient from an LCA perspective and much more cost effective.
That's Neil Dunn, CEO of Polymateria, talking there to Lottie Plashkes of the Green Minds podcast. It's produced by Lottie and her fellow students Alex Miller, Phoebe Scott and Guy Wilkinson on the MSc programme in Climate Change Management and Finance. And to hear the full version of that interview and a load of other excellent episodes, search for IB Green Minds in your favourite podcatcher. Well, as for this podcast, that's it for this edition, but we're on loads of different podcatchers: iTunes, Spotify, YouTube, SoundCloud, and also the visual podcasting platform Entail. Well, I'm Gareth Mitchell, bidding you a fond farewell for now, and we'll be back with more next time. See you then. Bye-bye.